And infertility seems to be more common these days. That's why we invited Dr. Sydney Chang. She is with CCRM Fertility. That's a new Austin fertility clinic, to KVUE News Midday to discuss the topic. Welcome, Dr. Chang. We appreciate you being here. Can you break down the numbers for us of just how it's on the rise, who it's affecting right now?
So 1 in 7 women in the United States is either having troubles getting pregnant or staying pregnant. So this is an enormous number. And
yeah, that's a higher number than I thought.
Yeah, so it's a problem that affects many. You know, it's not just a female problem, you know, it also affects males and couples. And so it's, you know, something that we've continued to deal with.
What are some of the reasons behind the rise?
So the biggest risk factor for infertility is female age. So we are born with all of the eggs that we'll ever have, and over time, the quantity and quality of those eggs declines. So as we've had longer life expectancies, you know, the biological reality has not changed. We were meant to have children
at an earlier age,
yes,
right?
Like right after you go through puberty, that's when biologically you are able to have a child. So even though we're living longer, you know, we're focusing on our careers, you know, people are just waiting longer to have children. And so that seems to be the biggest factor in why we continue to see this problem grow.
What about other environmental factors?
Certainly, you know, there are all of these different environmental factors, toxins, things that we continue to learn about. And, you know, that is something that is less easy to quantify, but certainly that is a piece of it.
And so when a couple comes and sees you, what do you do? How do you assess and what do you tell them?
So we do a full medical history. We're trying to identify risk factors, and we want to see, you know, if there are any obvious signs. So is she not having regular periods? You know, is there difficulty, you know, having intercourse at the correct time? We assess, you know, what is the quantity of eggs that remain? Is the sperm quality good? So we do a bunch of diagnostic testing to see if we can identify the cause of the infertility.
And we know IVF is just one treatment. Are there other treatments available?
Yes. So there are lots of other treatments that we do in addition to IVF. One of which is, you know, causing a woman to ovulate and doing an intrauterine insemination. So there are different ways that we can help patients get pregnant without doing IVF.
And so at what point of a couple having difficulty getting pregnant should they come see you? Is it in the beginning, month 6, month 8? What do you think?
So a lot of that has to do with a woman's age. So it used to be that we said, you know, try for a year on your own before you come in. As women are older, we say come in sooner. So at 35, come in after 6 months. At 40, come in right away. You don't have to wait for a year before you can see one of us.
There you go. And if you want to see Dr. Chang or you want more information, you can visit website. It is www.ccrmivf.com. Dr. Chang, thank you so much.